It's my pleasure to be with you all this afternoon. I want to thank Sil Zalkine and her amazing team at ACNJ for this partnership. Before I get started with my presentation, I want to first acknowledge the 500 plus childcare leaders and directors who courageously opened your centers on April 1st to children of frontline and essential workers. You made a decision of the heart that you would provide services, not really knowing what all would be required. Thank you. The parents thank you, the community thanks you, and the government thanks you because you were able to set aside your fears and see the need and address it. So thank you very much to all of you. You know, I'm in contact with providers every day, and when speaking with them, I realized how hard for some it might be to begin to think about transitioning to opening your centers. Some folks are overwhelmed. It's hard. For some, it might be scary. You might be anxious. And I want to acknowledge those feelings because they are all real to you. And that's okay. Remember that the governor said that centers can reopen on June 15th. He didn't say they must reopen on June 15th. So let's keep that in mind as we go through our presentation. But no matter when you open, there are some things that you have to consider. And the purpose of today's session is to help you think about the reopening strategies and help you move through the process. I want to add that you are not alone. You have state officials and departments that are here to support you. Commissioner Byers and Commissioner Johnson spoke yesterday about the resources and support that they have set aside for this critical transition. You have your local child care resource and referral agencies, and you have your colleagues. Remember the slogan, we are all in this together. I realize that centers are often competing, but now it's a time for collaboration and sharing. And then lastly, the goal is for centers to reopen. Families and children need your services, and the economy cannot flourish without you. First slide, please. The graphics on the first slide speaks to a blueprint, which is just a model. And as you can see, each set of blocks are very different. Just like you, every center is different, different capacities, different communities, different funding streams, but there are many things that are the same. And that is what we will focus on today and in subsequent sessions that we have. Next slide, please. The first, well, let's talk about our overview. We're going to focus on parents, staff, and financials today. Next slide, please. The first task assigned to you today is to have a parent check-in. It might look very different in each center. Some of you might have a Zoom meeting, others conference calls, some might conduct surveys, and others might have individual conversations with parents, or a combination of all the above. You have to do whatever works best for you. You have to have a conversation with parents because this is going to be the key to helping you reopen. You know, I'm a people person, so I would have to have a conversation and then also follow up with a survey. But remember, parents want to know how you are going to care for their children. I would suggest before you speak with parents, it might be a great idea or helpful to send them information about what your plans are. Even a summary of some of the OOL requirements telling parents what your plans are to keep children safe and healthy might be helpful. So what do you need to know? Directors need to know if families will return and when. And you need to know what are parent concerns. And some of their concerns will be addressed simply by what you send them in advance. You are now poised to engage parents and determine how many children you are planning for when you reopen. And I have to stress that you need to know how many children you're planning for when you reopen and what their ages are. So I'm going to ask Megan right now. She has been a provider that was open during this pandemic and ask her for her experiences working with parents.
Thank you. I want to take just a minute to look at what that parent engagement can look like as you're starting to look at the reopening process. As was mentioned, every center is very different. And so this is really meant to be a broad scope, swipe of what a reopening blueprint could be. There's really three components of engaging your parents to begin the step forward into reopening. The very first step is really understanding your program, your school, and your families. You need to have a firm understanding of what it will take for your specific center to open. Will you be able to offer the same hours? Will you have the staff to offer those hours? Can you afford the options that you're putting forward to the parents? And when you can open. You don't want to pull your parents on options that you already know that you can't provide. The second step that I would take after you do that self-reflection on your program is polling your parents in some capacity. That can look very different based on your own program and your own level of comfort, whether you want to do it through conversation or more through technology. But you want to extract primary information and secondary information is how a way to kind of organize yourself so that you don't get overwhelmed. The primary information is the who and the when. Who's coming back and when are they coming back? Don't get too caught up on too much of the weeds of the guidance when you're pulling this information from your parents. In order for parents to give you the information that you need, that you can use as an outline, is that you want to make sure in this survey that you give the parents information such as possible tuition changes and schedule changes. I would use the word if a lot if you're unsure. For example, if we need to shorten our full-time hours, will that affect your enrollment? You don't want people saying that, yes, they're going to come back, and then if you need to make a move on hours or something else, that now they're not going to come back, and that's going to throw everything out of whack for you. The second thing is when they're coming back. When are they willing and when are they able to come back? A lot of families aren't going to know this just yet, and that's okay. But having a sense on the contingencies that they're waiting for will help you. For example, if you know a family is not coming back to childcare until the public school opens, you'll be able to gather that information and know how many families are ready to come back once you know about what's happening with the public school. In the same example, you'll be able to know if families are waiting for jobs to recall them back as we move in through the reopening process in the state. You'll start to understand how that's going to affect your enrollment. And then the other thing is that if there are enrollment timeframes, you want to be very transparent with that with your parents. If they don't come back right away, will they still have a space? You don't want a parent to say that they're not ready to come back and then not understand that what that means is they're not going to have a spot in September because there are other children coming into that. So just make sure that you're very transparent on how their decisions and what they're communicating will affect them. The second part is what I like to consider the secondary information, and those are all the concerns that parents are having. You want to make sure that you're able to articulate exactly what they are concerned about, how their children while they're with. It's key to understand the guidance in how it will affect your families most. You don't need to communicate the whole guidance to your parents at this point, but know which factors are going to affect and change your program the most. It's key to know your family's needs. Centers across the state look very differently. Their parent base and family base looks very different, and understanding things as simple as, for example, drop off and pick up procedure. If you're a center that's on a train line and that timing of dropping children off is very contingent on how they're going to be able to get to work, that's something you're going to want to highlight and pull as how that's going to affect them coming back. That being said, I would cap these things to about 5 so that the parents aren't getting too overwhelmed, and know that the concerns that your parents have are going to drive your ongoing engagement. So the things that they're bringing back to you right now, you're going to want to hold on to that information to engage them throughout the reopening process. Bev, do you want me to go into the ongoing parent engagement conversation at this point as well? Okay. So then the last piece is that ongoing parent engagement. And once you have all of your enrollment information, you're going to need to provide some policies and procedures. That's going to look different. Everybody's is going to change in different ways. And you want to make sure that you're giving your parents what this is going to look like so that they know upfront what their level of comfort is. There are resources out there on NJAEYC's shared resources page. There are a lot of templates that you can use just to even get your mind going on what some of these policy changes that you need to push out to parents are. It definitely needs to include the changes that you'll be making or that may happen around payments, tuition, co-payments, security deposits, timing, and payment commitments in the event of a short or long-term closure. You want parents to have that information as they're committing to coming back or not coming back. These are going to look very different for every program across the state. So just know your program as you map that out and make sure that that's a piece of that communication. Many directors have expressed that they will want to have their parents sign off on these new policies and procedures as well. I would also recommend preparing a first week or first wave survey for your parents so that you can get a pulse on how families are feeling about the new environment. Following up on these concerns that are expressed in that poll of that secondary information will be important. And you can create responses to concerns that you're ready to discuss with parents, especially around suspected and confirmed cases within your center. So reaching out to your health department will be really important, and having that verbiage ready to give back to parents, because it's definitely going to be of high concern. Once you have all of the point of having it ready is that we all know once we get back, it's going to be all hands on deck. So creating that survey before you open so it's ready to push out to the parents will definitely help you manage things on those first week or two. Many directors I've heard have hosted or plan to host Zoom meetings with parents. This can be individual, it can be by class or group, or even with the whole center. It's a tool that can be used before opening or after, but a great way to engage the parents so that they feel like they can communicate their concerns. Create a way for dialogue. I think that's something important to think about. Without the open door policy for parents that many of us are used to, you're going to want to think about how you're going to engage that dialogue with parents. And then two things I think is really so very important is to give concrete and reliable dates of when they can expect to have information from you and when they can expect to hear from you. Parents are trying to plan, and they can give you more accurate information if you can give them concrete dates to work with as well. And then finally, my last advice would be on parent engagement would be to create a nice balance of listening and responding. There are a lot of concerns that parents are going to have. They're going to be outside of your wheelhouse as a child care provider. And sometimes they're just going to need you to know that they're concerned or overwhelmed or dealing with a lot of different struggles. And sometimes they're going to need that quick response and need that comfort that you have things under control, that you know that you are keeping their children safe, and that is your first priority. And balancing those two as you keep those conversations open. It seems like a lot, and we know this, but I will say that you do have this, and if you can create that relationship with your families and just let them know that this is a positive step forward and that we're excited to get back to opening childcare, everything else will slowly start to fall into place.